So you do adult orthodontics?
Yeah, we do some relatively simple, quick, fast, comfortable orthodontics. We are specific to the cosmetic zone. We call it cosmetic orthodontics because it doesn't affect your back teeth. Okay, if you have something wrong where you have a skeletal issue or your back teeth need some work on it, it's inappropriate. You're not a candidate for this. The ideal candidate for 6-month smiles or one of the fast smile type procedures is somebody who had braces when they were a kid, everything was fine, but they lost their retainer or they stopped wearing their retainer. And so now the teeth are starting to drift back. You're getting a little relapse of the old. And you can see that most people will say, yes, that's the way my teeth looked before I got the braces. Okay, so what we're able to do is relatively simply just kind of, I used to tell people that, gee, I wish if I could just soften up your gums and twist your tooth a little bit, that would get that'd be great. It's kind of what we do now, okay? Usually takes between 4 and 8 months, okay? We know.
And these are like invisible braces? I mean, they're not metal brackets?
Well, they're not metal brackets. I'm sorry, they're metal brackets, they're white.
Okay.
They're relative, you really can't see them unless you're up close. You do feel them, they're on the outside of your tooth, and so your lips do feel it, so it's there, but it's only for a short time.
You like it better than Invisalign. I think you told me that.
I do. Invisalign, I like the absolute control over this. Invisalign, you have to have the person has to do exactly what you say. You have to have them in a certain amount of time. This way,
like 23 hours a day. For
23, unless you yeah. And if you don't eat, make it 22. You want to have them in all the time except when you're eating. This, okay, there's not a problem because what we do is with the bar, the metal band basically straightens the teeth very slowly and equal pressure, so there's no adjusting, no getting the new tray and putting it in and having to wait 4 or 5 days of discomfort. Then just when it starts feeling comfortable, you get a new tray. That goes on for a couple of years in a lot of cases.
So you're only moving the teeth that are showing?
You're just moving the teeth that are showing, okay, and you're moving very slowly. It's funny because it happens fast, but you're moving them slowly, but it's the same amount of light pressure. And so you don't have those, I mean, when you were a kid, you might remember going in and they would tighten your braces and it would hurt. And then after you'd go back the next week, do it again, it would just start feeling a little better, day 5 or 6, and then tighten it again. It doesn't happen this way. It basically is an even keel, and it's really not uncomfortable at all.